The questions we are answering now is that we are prepared too much. And we are prepared for even our friends. I ask the people of my great country that the American people and government have been partners with us on matters health for close to 25, 30 years. American resources, American taxpayers' resources have been used to support Kenyan health infrastructure. It would be most unfortunate if on one request by the Americans to set up a facility at their cost, we would refuse. We would look very inhuman. And I can tell you without fear of any contradiction, and I can look at everybody in the eye, Kenyan, including yourself, and tell you we are doing the right thing. Ebola is a pandemic that is not confined to one place. And just for context, there has not been a single reported incident of Ebola in Kenya, just for context.
Yes.
So the big debate is going on, yes. But that is the correct position.
Absolutely.
Number two, the Ebola situation in Eastern DRC is a source of concern for any country, including Kenya, that is mindful of matters health of its citizens. And the responsible thing to do when there is reports of such high-level infectious outbreak in a region where we have thousands of citizens, Kenyan citizens in DRC. We have soldiers in DRC. The most responsible thing to do is to prepare for any eventuality. And that is what Kenya has done. We have prepared ourselves adequately. We have taken command of all our entry points. We are doing testing of every person coming into Kenya from anywhere near that region. We are testing close to between 2,000 and 3,000 people from all our entry points every day. We have mobilized resources, testing kits, reagents, and all manner of people. We have trained thousands of staff, health staff, to be able to handle that situation. We have now isolation facilities, 23 of them across the country, in different parts of the country. And one of the facilities that has now raised a bit of controversy is the facility we agreed to set up in conjunction with the Americans in one of our military air bases. And why have we done that? We have a huge American military contingent in Kenya, number one. Number two, we have set up the 23 other isolation places in Kenya with the support of friends, among them the Americans, our own resources, but also with the support of Americans. The American government has supported us in this Ebola setup infrastructure, health infrastructure, to the tune of 1.8 billion Kenya shillings. And they did make a request to us to, in the process of setting up all the other facilities, to also set up one where they can use in the event that their citizens, their soldiers, some of them in Kenya or from elsewhere, if they are in a situation, then they can use that facility. For context again, even if the Americans had not set up that facility at the military base, if there was any American in Kenya, we would take them to a Kenyan facility. We would not throw them out, because The Constitution of Kenya tells us that we are responsible for the health of the citizens of Kenya, including those who are in Kenya at any one time. So what you see as a debate in Kenya is lack of information. You know, people who may not have enough information to understand what we are doing. If we don't prepare and a situation occurs, we would have to answer much more difficult questions than the ones we are answering now. The questions we are answering now are simpler. They are easier. But if we were answering questions when people are sick and we haven't prepared enough, then we would be answering much more difficult questions. Where were you? What were you doing? What did you do? You knew there was a pandemic. You didn't do nothing. You know? The questions we are answering now is that we are prepared too much. And we are prepared for even our friends. And you see, I ask the people of my great country that the American people and government have been partners with us on matters health for close to 25, 30 years. PEPFAR and all the other funds. American resources, American taxpayers' resources have been used to support Kenyan health infrastructure. It would be most unfortunate if on one request by the Americans to set up a facility at their cost, we would refuse. We would look very inhuman, you know? So the debate here is not about whether to set it up or not. The debate is, are we doing the right thing? Are we not? And I can tell you without fear of any contradiction, and I can look at everybody in the eye, Kenyan, including yourself, and tell you we are doing the right thing. What the American government is doing is to work with us in partnership to build the capacity to make sure that if ever we needed a facility, that facility will be there to serve the people of Kenya and to serve our friends, including the Americans. And let me say this, for the avoidance of any doubt. This is not the first time we are doing such a facility with partners. During COVID, we built a whole facility. I am wondering why anybody would want to politicize, to mobilize negative politics on a matter so serious as a pandemic. You know, we are a responsible government. We know what we are doing. So people should relax. You know, politicians should avoid reckless, unnecessary talk that doesn't mean anything. I am very confident about what we are doing as a country. I can assure the people of Kenya that the agreement between the government of Kenya and the American government is for the good of our country and for the partnership that friends like the American government have demonstrated to us over time. They have deployed huge resources. They've given us a grant of close to 200 billion Kenya shillings to support the building of our health infrastructure. They've done it before. It's not the first time. They're doing it again because that is the nature of international solidarity. That's the nature of friendship and partnership with people whom you share common values, like the way we do with the American people. So I say this just to make sure that anybody who wants to know what it is. This is from me. The same way I am serious and committed about making sure that every citizen, irrespective of their financial or social status, has access to health. It is the same commitment that involves our commitment to dealing with pandemics, including Ebola. I want to assure this nation that we know what we are doing. You know? We have many partners. I will give you an example. We've had the challenge of COVID before. We now have the issue of Ebola. But I want to assure this nation that the government of Kenya has made adequate arrangements. We have deployed every arsenal that we have to make sure that we protect Kenya, that we deal with the challenge. We have made preparations for isolation units, for surveillance, for treatment. In 23 counties, we have activated different mechanisms, and different hospitals have been already set up to make sure that if there was a case of Ebola in Kenya, we would know what to do with it. As I talk to the country this evening, we are screening every day any visitor who comes to Kenya. All our borders are on high alert. All our borders, land borders, air borders, are already activated. There is surveillance, there is screening. On average, we screen close to 3,000 people every day who either come to Kenya or are in transit, to make sure that those who show symptoms, we quarantine them, we isolate them, test them. Fortunately for our country, not a single person tested has tested positive for Ebola. And I want to ask leaders and citizens who have any doubt on the level of preparedness by the government of Kenya, that they should not have any such doubt. Our partnership with our friends, the American government, is a partnership that is mutually beneficial to us and to them. When President Trump asked the government of Kenya to support them by having a center in Laikipia Air Base, I gave the okay because it was an agreement and a partnership with friends who have worked with Kenya for 30, 40 years. The American government has supported us. They have deployed huge resources in Kenya to work with us on HIV/AIDS, to work with us on other diseases. They worked with us on Ebola. In fact, KEMRI was one of the institutions that worked on research on the vaccines for COVID, because we have a solid partnership with America and other partners. So the facility that is at Laikipia Air Base is not a facility different from all the other facilities that we have across Kenya. We have 23 other facilities set up in Kenyatta Hospital, in the police hospital in Nairobi, in Moi Teaching and Referral Hospital in Eldoret, in Kenyatta Hospital in Thika, in Alupe Hospital in Busia, and in many other areas. And these facilities are meant to make sure that there is proper screening, and if there is any positive identification of people who have Ebola, then immediately they are isolated, they are treated so that we avoid any spread of the disease. So I want to ask those who are questioning our preparedness or our preparing to make sure that we deal with a challenge if ever it gets to our country. What are they telling us? They are telling us we should not prepare. Are they telling us we should not be ready? And the fact that we could end up with a case is not far-fetched. We have security people serving in Congo DRC. We have thousands upon thousands of Kenyans in DRC. If, for whatever reason, they were to become victims of Ebola, we would have a responsibility as a country to treat them. We would have a responsibility to our citizens to make sure that we take care of them.